Hello, everyone. So, today we are going to go over the Australian framework of COVID-19 infection control, how to protect the people you are caring for and yourself. This version is in the English version. Let's get started throughout all the chapters and sectors within this course. Firstly, we are going to go through the introduction. This is a training of the fundamentals of infection prevention and control for COVID 19. What is COVID 19? Symptoms and signs, how to keep safe, protecting self and others, myths and facts about the COVID 19. The duration of this course will be approximately 45 minutes to an hour, depending on how fast or how slow you want to go through each segment. At the end of the segment, you are actually required to complete a exercise that will enable you to understand all the parameters, and also afterwards you'll be getting a certificate once all the aspect is actually completed throughout all the checklists. So let's get started within this course. The overview of this course and its contents in total will be approximately 8 chapters. Let's get started with all the different chapters and starting from our learning objectives. When we are discussing and talking about the learning objectives, at the end of the outline, we would like you to be able to understand the basic outline of COVID-19 virus from the initial outline to the spreading of the virus. You will have the ability to protect yourself and others, understand how the symptoms actually develop, have clarity into what to do if a person around you are developing symptoms, and also understanding all the different aspects of COVID 19 at the present and current time that the course has been written. It's always advised, even if this course has been completed, you should always keep up to date with your local government's regulations and outline provided by your local council and government in your country. Let's get started on the background of COVID 19. This virus are a family of coronavirus that can make humans unwell. The new coronavirus disease, or in another name, is known as COVID 19, which originated from China in 2019 and has spread worldwide. The cluster of this disease is spread throughout the world through the borders. Currently, lots of borders are being closed. A little bit about background further. Around 80% of people who become infected only get mild symptoms and fully recovered with no special treatment. 15% who are infected with COVID 19 will gain moderate symptoms. A small number of approximately 5% will gain severe and get sick very quickly. The virus, or the meaning of virus, actually means that viruses are not a living or require a living host such as the human body to survive, grow, and reproduce. A virus grows by depending on the host cells to multiply. Once inside the human body, a virus can quickly multiply, which causes illnesses. Some infections which are caused by viruses may or have heard of, which are the current coronavirus, German disease, herpes, HIV, AIDS, hepatitis B and C, influenza, common cold, malaria, varicose. These are the overall meanings of viruses. So, as I like to mention, viruses are not living, so they require the living host, which at the moment is the human body. This is the image of what the coronavirus actually looks like. With the common symptoms, fever, flu-like symptoms such as coughing, sore throat, and fixture are spread through droplets, breathing shortness. COVID 19 has multiple symptoms. Although not everyone has the same symptoms, we must always be aware that the mentioned symptoms are also causes from other illnesses as well. So be sure to check with your medical advisory. Some symptoms of the COVID 19, which are the main symptoms, are in 4 categories. 1, fever. 2, cough. 2, shortness of breath. 4, sore throat. When we're talking about the signs and symptoms, these are the 4 main categories. Let's go on to the next part. When we're talking about the next part of our chapters, we are going to go through the understanding that what are the higher risk populations. For example, if people develops illnesses and are seriously ill, the people that are on a higher risk level will be older people or toddlers, person with underlying medical problems as well as high blood pressure, diabetes, heart problems, diabetes, low immune or immune deficiency and respiratory diseases are also at risk, although elderly at the moment is considered the highest risk. In the next chapter, we will go through who can catch the COVID-19. At these times, we all need to be safe, and really, anyone can be affected. The virus doesn't discriminate between gender or race, therefore, it is so important to keep everyone around us and ourselves safe. The virus of COVID-19 spreads via droplet transmission. Droplets are small pieces of saliva produced by a person's sneeze or coughing. The droplet usually travels no more and no further than 1 meter via the air. It is also good to mention how it actually spreads within these parameters and how does these virus have the possibility of infecting another person. If a person is infected, coughs or sneezes while close with another person, the infection actually occurs. A touch with an object that is contaminated, for example, door handle, keyboard, or steering wheel, can also cause an infection. Droplets are unable to go through one's skin and can only affect via touch of eyes, nose, or mouth via the droplets. So always ensure you understand all these aspects in order to fully maintain infection control for COVID-19. When we're talking about how the COVID-19 actually spreads, instruments that has contamination, such as steering wheel, door handle, keyboard for instance, can all become contaminated. The contamination may be by droplets of fluids, substances passed from the persons handling the instruments or any surfaces. Infection may occur when contaminated instruments or surfaces are not clean or sterilized. Contamination may also occur when a single-use instruments are not discarded immediately or constant cleaning is not completed. Poor hand washing or wearing of protective personal equipment should also be understood. When we're understanding the chain of infections, we have to understand the stages that the virus is actually transmitted and how the microorganisms or germs are spread. The chain of infections are as follows. The infection agent goes to the reservoir of the transmission, goes to the portal of entry, goes to the means of transmittance, pass through the portal of exit to the substantial host. When we're talking about the COVID-19 and the chain of reaction with the COVID-19, the chain of reaction becomes as follows. The infection agent is the person with the COVID-19, which passes and transmissions of the droplets, then goes to the portal of entry via coughing or sneezing. The portal of entry then gets transmitted by bodily fluids, which once again goes from one person to another with a successible host of the COVID-19, and the chain actually reoccurs until cure has actually been created. We are still going to create this change of infections. Therefore, there is all the implementation across border that is provided throughout the states. So always ensure that you check each state's requirement. How to stop the spreading? It is a collective of everyone to actually stop the spreading of COVID-19. All precautions must be taken into consideration from family, friends, co-workers, and visitors. It is also very important that you should be able to lead by example. Further information can be found at your local government or medical advisory sector within your country. For example, if it was in Australia, Australian National Health and Medical Research Council, or your local state council sites. The main points to consider: 1. Practice good hygiene. 2. Avoid sharing food. 3. Avoid sharing tools and equipment. 4. Ensuring surfaces touch and use is safe at all times. 5. Towels and coverings should be changed after each person's use. 6. Always use clean instruments. 7. Avoid personal contact. 8. Facilities and spaces to be clean at all times. 9. Protective wear is to be worn at all times. These are the 9 basic principles and basic points to actually consider. Next, we're going to go on to how to stop the spreading. This sector we will outline the basic steps and measures that you would need in order to protect your own health and the health of others. The key points of how you can decrease the risk for people in your care. C. Principles of how you can protect you and those around you. When we're understanding sterile or sterilization, which is a term that is referring to any process that removes or kills all forms of life, including transmittable agents such as fungi, bacterial, viruses, which are present on a surface or contained in a fluid such as saliva, liquid, from a cough, pigments, or water, etc. Contamination occurs when there is a break in the chain of infections or sterilization is no longer present. Contamination is the spread of organisms from one item to another. So that is the overview of what is sterile and sterilization as an outline. Next, steps to the precaution. I have sectioned out steps into the precautions under 6 different steps. Step number 1, clinically clean your hands using hand sanitization, hand washing, and drying of the hands. Step number 2, use of clean surfaces, clean items, and clean products. Step number 3, safe handling of used items with clean concepts and disposing of it accurately, safe, clean, and disposing of wipes, safe, clean usage and disposing of sanitizing bottles. So always ensure your outside of your sanitization bottles is always clean as well. Step number 4, correct cleaning of clothes and external wear. Step number 5, use of protective barrier when in public or around another. Step number 6, distance between one person from another person at the moment is 1.5 meters. Next, we are going to get a clear understanding of items you can actually get. Hand sanitizers, disinfecting spray for your hands, disinfecting spray for your surfaces, PPE, personal protective equipment such as apron, gloves, masks, goggles, or even sunglasses or your glasses. All these items would actually help in preventing cross-contamination and the control of the COVID-19. Once we understand this, we have to understand each particular measure. For example, with hand washing, it is highly important to protect yourself by regularly washing your hands with soap and water or rubbing alcohol-based hand sanitizer on your hands. Viruses has the ability to be on your hands, so always ensure that you accurately wash your hands and cleanse your hands so that it doesn't allow the virus to be removed or moved to the transmission barriers and transmission portals. Next, we are going to go through the cleaning of your hands with a double cleansing method. Warm soapy water with disinfectant. Always ensure the tips of your fingers underneath your nails, palms, top of your hands, spaces between your fingers underneath your nails are all clean. Plus, even when you're actually going out, always ensure that the skin that has been exposed and considered from hands especially are also not actually going to be exposed to any liquids from an infected person. So always ensure hand washing is accurate. With the World Health Organization, this is the outline and the 12 accurate steps of actually hand washing throughout all the methods. The next one is the World Health Organization hand rubbing methods. This also considers an accurate outline of 9 different steps and protocols to accurately rub your hands when using a hand sanitizer. If you focus on these different aspects and the slides, you will have a more clearer understanding and clarity with all these different aspects. When we are talking about the next aspect, we will be mentioning another aspect that will be a safety precaution. Just as an outline, hand washing makes sure you actually regularly wash and cleanse your hands for cleanliness. It's always important to wash hands after going through after blowing your nose or going to the toilet, and also after eating. Working in residential and healthcare facilities must always ensure that all visitors should wash their hands and when leaving and entering a facility for your safe zone. Always ensure that the premises has a hand sanitizer at the front, suitable hand washing facilities for your guests and for yourself. Floors, walls, and ceilings, benches, and all surfaces must always ensure to be thoroughly clean, joint between the walls, floors, ceilings, and always ensure that all these aspects provides maintain infection control hygiene conditions for the premises as well. When we're talking about the premises, always ensure that all these aspects from the wash area, floors, walls, ceilings, and joints, floors, ceilings has actually been sanitized, and also this is actually a really good step to keep all these parameters clean and hygienic for all your members. Next, we are going to be talking about waste disposal and use of tissue wipes. Paper towels should only be used once and thrown out. All bins used for waste must be lined with a plastic bag that can be sealed for disposables with a lid that closes. It is essential that clinical and waste is properly packaged, labeled, handled, and transported to minimize the risk of occupational exposures and exposures within your environment to control the transmission of infectious virus to both waste handling and the community. So this aspect is always to ensure waste disposables is actually done correctly. Next, we are going to be talking about your PPE, personal protective equipment, which is gloves, goggles, and masks. We advise that gloves is to be used once and thrown out after use or going outside, as this can be contaminated. And we also advise that glasses or goggles should be cleaned after entering or exiting our safe zone or residential area. Mask, if it's used once off, should be actually thrown out, but always check with the manufacturing parameters. It is advised to read all your hygiene parameters of manufacturing accurately to use all your PPE with the utmost care. Next, we are going to be talking about all these different PPE in more of a detail. We are going to be focusing on the glove usage. When we're talking about the glove usage, it's always important that this precaution is a precaution that is to be used as an extreme measure. Let's have a look at the way you remove your gloves when completing usage of this. When we're removing our gloves, the gloves can be removed and washed out, and finishing of your cleanliness of your hands is to be created. When we're talking about glove removal technique, this glove removal technique is advised when you're going outside and wearing gloves as well. When we're talking about clothing, we also must ensure that the clothing that we wear is clean. We also ensure that we're washing the clothing more frequently, especially if we're leaving our house. Watches, wrist bracelets, your jewelry should also be cleaned at all times. When we're talking about our masks should be worn at all times to prevent the splashing or splattering of COVID-19 virus substances. Always ensure that it is correctly worn. Ensure that the right side of the mask is used. Ensure that the mask duration is considered as labeled correctly on the manufacturing details. Ensure correct disposables of all masks is actually considered as well. When we're talking about eyewear, this is a very safe and utmost precaution that you can wear protective wear. And it has the possibility of considering splashing or splattering of COVID-19. Precautions of eyes should be protected, which can be from and may include glasses, sunglasses, goggles. But when you're actually using them, always ensure when you're coming back into your safe zone, you're always actually cleaning the protective eyewear as well. Even though this aspect is not mentioned in the Australian framework, this is due to a very high proportion that eyewear and gloves should actually be worn, especially when traveling overseas would be a higher risk of contracting the virus. The next aspect we're going to be talking about is touching of the face. When we're talking about touching of the face, we have to actually limit it touching the face, obviously, because it ensures that the virus droplets on the hands are not able to transfer to another area such as mouth, eyes, nose, as they can actually infect you. Try to stop yourself and others in this case or in these circumstances by avoiding touching your face on multiple instances. Another aspect to actually be aware of is always ensuring a social distance from one another. When we're actually talking about distance, we are ensuring that the viruses cannot be transmitted. Always ensure that you maintain distance between you and the other person for 1.5 meters, especially when coughing or sneezing. If you're being too close to anyone, you always have the possibility that you might breathe in the droplets from another. If you are 1.5 meters away from another person, it is highly unlikely that the droplets will transmit, especially ones that contain COVID-19 virus. Social distance is therefore very, very important as it will help the spread of the virus if the 1.5 meters is a precaution. Next, we are going to go through the ability to greet or handshake. When we're talking about handshake, especially in this time and season, we are not able to accurately handshake one another. So always avoid this during this time. We can always greet the person in another way. Always ensure that good respiratory hygiene is of the utmost care. Always ensure that your mouth and nose is covering while coughing or sneezing. Always ensure tissues is used and put in the wastes after your use. Always remind everyone for proper hygiene. Make sure you are always carrying hand sanitizer, tissues, and correct PPE. Always ensure cleansing of hands is done as well as good respiratory hygiene. An important note to actually note in this regard and our regard for COVID-19 within this course is wearing your PPE, personal barrier equipment, which is that has been mentioned, masks, gloves, glasses, which will actually only be used as a safety precaution. Only wear eye masks if you have symptoms that might be visible and accurate at the time. Only wear masks if you have symptoms. So always ensure that you maintain infection control when outside. Important notes to mention, always protect yourself first and always ensure you help others that are in need. Regularly wash your hands, use respiratory etiquette, maintain social distance, avoid crowded areas. Ensure all infection protocols is also actually considered. When talking about all these points, it's a point as an overview for all the aspects we have actually mentioned. When we're talking about all these different aspects, the next aspect to actually understand is cleansing and disinfection as well. The next step that we are going to go through in this course deals with cleaning and disinfectant. When we're talking about cleaning and disinfectant, this is a safety precaution for the COVID-19 virus. When we're dealing with cleaning and disinfectant, we always have to accurately and regularly clean our hands and sanitize our hands as a first precaution. regularly clean your workstation, your home environment, your car, your work area, and your office, as well as your home. If you're going to be working from two different instances, always clean the surface that you have used, such as tables, light switches, door handles, and other surfaces. Always ensure that clean detergent solution is used and follow the correct manufacturing parameters. When we're talking about cleaning in residential and healthcare areas, there's two aspects throughout this outline. When we're talking about two aspects throughout this outline, there is frequently touched surfaces or minimally touched surfaces. When we're talking about frequently touched surfaces, there are things such as door handles and keyboard light switches, which should be cleaned frequently. So all these areas should actually be cleaned frequently with a detergent solution and can be used in accordance to the manufacturer's outline as well. So always ensure that the detergents and wipes can be used on all these surfaces with cleansing with the correct application method. When we're talking about minimally touched surfaces such as floors, ceilings, walls, and lines, these areas should also be clean on a higher basis throughout this time. Detergents and solutions can be used, even wipes that has disinfectant can be used, but always understand that we can have the ability to clean all the surfaces once and with a damp cloth, even with a damp mop on the actual floor area. Always ensure that the products you use are new, sterilized, and always ensure that each of these aspects mentioned has been cleaned thoroughly. So now you have the understanding of cleaning your surfaces, which is frequently touched and minimally touched as well. So within these topics, we are next going to go through the food and safety precautions. Even though food is not a way of transmitting the virus, we can ensure and be aware that from the information at this time, it is not able to pass via food, but one should always ensure food safety precautions is of the utmost care. Food preparation must be cleaned from preparations to cooking and cleaning of that particular area. When we're talking about food, health, and hygiene, we always have to understand that when preparing the food, our hands must be thoroughly cleaned before touching our foods. Then we always have to ensure we're using gloves when actually cooking at a prepared area. Always ensure that the prepared area is actually thoroughly clean. Ensure all equipment and food tools are thoroughly clean. Ensure all meats are cooked properly. Chopping boards for raw foods and another for cooked foods should actually be used for this instance as well as a safety precaution. When we're talking about food safety, it is always good to mention that when preparing the food, respiratory etiquette has to be of the utmost care. As mentioned previously, what the respiratory etiquettes are. Next, we are going to go through the visitors management. When we're talking about the visitors management, we are enabling a safe handling of the COVID-19. This does not mean banning on any social life events. It is important and essential to maintain relationships. If a person is unwell, it is advised for them to stay at their own home and not visit others. Person with high risk should also stay in their own room. Visitors to residential facilities are encouraged to wash their hands upon entering or exiting the facilities. This will actually reduce any risk. When we're talking about taking people in your care out in public, it is highly recommended that hand hygiene, social distance, and respiratory etiquette is essential in a public setting. Hand hygiene also considers after touching shared services, maintain social distance, and avoid large public gatherings. When we're considering taking people out, always ensure that all these aspects are considered as it will help control the COVID-19 within a safe parameters. But even in this case, always make sure that you are allowed to go out and are not in the rule of self-quarantine. Please check with the local council and your government for the rules and regulations. When traveling and with COVID 19 occurring, it is important to be aware that this COVID 19 is imported from overseas, so always ensure you stay up to date with the news and events. Always allow for a clear understanding of the current events to unfold from a reliable source. Australian latest updates can be found at worldwideweb.health.gov.au. Once we've understand the travel and the COVID parameters, we also actually have to understand that when we're traveling, all our PPE has to be worn, health and hygiene must be of the utmost considered. And as soon as you feel that you have symptoms, you have to become of what to do next. So in the next part, we are going to go through if you have symptoms, what should you do? 1. Stay at home and practice infection control precautions, seek medical advice, and ensure to call ahead for any appointments with your medical practitioner. Always ensure that you have a healthline number for your country available at hand. For example, within Australia, healthdirect.gov.au or National Coronavirus Information 1-800 020 080. Call your healthcare provider and ask them for advice and appointment in advance. If you're going to work or if you're going to stay at a workplace, always ensure that you contact your employee or your employees in order to understand the parameters that will be placed within this time frame. When we're talking about the rules and symptoms, when you have all these precautions, we are also talking about these precautions and symptoms in order to accurately maintain infection control. When we're talking about maintain infection control, we always have to understand and analyze the different aspects. In the case that someone in your care develops symptoms such as dry cough, sore throat, fever, figure, always follow the following instructions. Follow them, allow them to actually stay at home and practice infection control. If the case actually gets worse or you feel that there is a need for medical advice, always ensure you seek medical advice as soon as possible and ensure to call ahead for any appointments. Ensure maintain infection control is of the utmost care and seek medical advice promptly and remember to call ahead. When we're talking about all these aspects, if the person that develops symptoms are going to leave the house to go to the medical practitioner, always remember all the different aspects of accurate health and hygiene and wear the accurate PPE. Let's talk about a little bit of facts. Cold weather and snow will not kill the virus. The virus can be transmitted in areas with hot and cold climates. Taking a hot bath does not prevent you from the virus. The virus are unable to be transmitted through mosquito bites. Let's go through the overview and the key messages of this class. When we're talking about the key messages, practice good regular hand hygiene, practice social distance, practice respiratory etiquette, practice correct PPE use, ensure all PPE label is understood, keep calm whilst in self-quarantine, and always check with your local council and government regulations to keep up to date with what is happening. Next, we'll do an overview of what you actually have learned throughout the class. The final message that you have learned is the understanding of coronavirus, what are the common symptoms, how you can protect yourself, what is the precaution with your cooking, what is the social distance, what is your PPE, what to look for on a manufacturer's PPE, which group is more likely to become ill, and all these other factors that we have previously mentioned. So within this time, I thank you for doing this class within the COVID-19 infection control. Next, we'll go through a little bit of exercise. Once you've completed the exercise, you'll receive your certificate.